If you want to notice certain bodily signals before they turn into bigger problems, you might need to pay attention to a place that almost always only gets attention when you're brushing your teeth: your mouth, bleeding gums, a changing tongue, saliva that seems to disappear, and breath that doesn't improve may seem like isolated details. Often, they are local and treatable changes. In other situations, they may be clues that medications, habits, inflammation, or general health conditions deserve evaluation. This doesn't mean you can diagnose a disease by looking at your mouth in the mirror. The mouth doesn't function like a laboratory test. It's more like a car's dashboard. A light on doesn't automatically reveal which part is faulty, but it warns you that ignoring the signal might not be a good idea. Today, we're going to look at 6 signs from the gums, tongue, saliva, and breath that may warrant a visit to the dentist or another healthcare professional without alarmism or turning common signs into diagnoses. Do you enjoy videos about health science? Then subscribe here. Our commitment is to bring you serious and up-to-date topics. Help me bring this topic to more people by clicking the like button here. Now let's get down to business. Number 1, the red gum line. Start by observing the tissue surrounding your teeth. When plaque remains along the gum line, this tissue can become red, swollen, tender, and bleed. Imagine the gums as a delicate seal around each tooth. When the seal remains inflamed, it begins to lose stability. Most of the time, bleeding is linked to gum inflammation and requires proper hygiene and dental evaluation. But context matters. Smoking, certain medications, and conditions like diabetes can increase the risk or severity of periodontal disease. This doesn't mean that bleeding gums are a sign of diabetes. It simply means that frequent bleeding, swelling, receding gums, persistent bad breath, or teeth starting to move should not be ignored. Number 2, the mobile surface of the tongue. While the gums protect the edges of the teeth, the tongue acts like a large living carpet in the center of the mouth. It accumulates debris, cells, and microorganisms, so its appearance can vary. A thin coating upon waking, for example, does not automatically mean there's a disease. What deserves the most attention is persistence. A white or red area that doesn't go away, a wound that remains open, a lump, unexplained bleeding, numbness, or difficulty moving the tongue should be examined. Think of the tongue as a canvas that can receive food marks, friction, dryness, infections, and many other changes. Because different conditions can produce similar appearances, internet photographs are not a substitute for a professional examination. When a change persists for more than 2 weeks, it is recommended to see a dentist or doctor. This does not mean the lesion is serious. It means its duration warrants proper investigation. Number 3, the protective river of saliva. The change in language leads us directly to an almost invisible element: saliva. It's not just for moistening the mouth. Saliva helps with chewing and swallowing, removes food particles, and contains minerals that help keep teeth strong. Imagine a small river flowing through your mouth all day long, diluting waste and helping to control the environment where millions of microorganisms live. When this river decreases, symptoms such as a sticky sensation, chapped lips, difficulty speaking, chewing, or swallowing, altered taste, burning sensations, sores, and bad breath may occur. Occasional dry mouth can occur during times of nervousness or stress, but persistent dry mouth should not be treated as an inevitable consequence of age. Many medications can reduce saliva production, including some used for high blood pressure, depression, and bladder control. Certain illnesses and medical treatments can also cause this problem. The safe approach is not to stop taking the medication on your own. It's to talk to your dentist and the prescribing professional so that the cause can be investigated and the treatment, if necessary, adjusted safely. Number 4, the invisible trail of breath. When saliva production decreases, breath odor can also change. Bad breath acts like smoke. It indicates there's a source but doesn't immediately tell you where it is. Bacterial plaque, tongue coating, gingival inflammation, dry mouth, tobacco, certain foods, and some medications can contribute. In some situations, the origin may be outside the mouth, but this should not be assumed before a dental evaluation. Candies, chewing gum, and mouthwash can mask the odor for a while. It's like opening a window to hide the smoke without extinguishing the source that's producing it. When bad breath persists despite proper brushing, cleaning between teeth, careful tongue hygiene, and hydration, the next step is not to indefinitely increase the use of strong products. It's to find the cause. The dentist can check gums, cavities, tongue, saliva production, and the condition of dentures. When necessary, they may also recommend a medical evaluation. Number 5, wounds that don't follow the expected timeline. From breathing, we arrive at how the mouth recovers. Minor accidental bites, burns from hot food, and canker sores are common. The important sign is not an isolated lesion that usually heals. What deserves attention is a wound, irritation, thickened area, red or white spot, pain or bleeding that persists for more than 2 weeks. Imagine the oral mucosa as a wall that is constantly renewing itself. When a mark does not follow the expected healing process, it needs to be examined. This doesn't automatically mean cancer, nutritional deficiency, or infection. It simply means that persistence changes the level of attention. People with diabetes may experience more severe gum disease and oral infections with slower healing. However, none of these signs confirm diabetes without clinical evaluation and appropriate tests. Number 6. The pattern is worth more than an isolated signal. Now put all the pieces together. A gum that bled once after aggressive brushing doesn't tell the same story as a gum that has been inflamed for several weeks. Dry mouth during a moment of anxiety is not the same as waking up every day without salivas and having difficulty swallowing. Bad breath after eating a particular food is not the same as a persistent odor accompanied by bleeding, swelling, or receding gums. The key is to observe 4 elements: duration, repetition, intensity, and associated symptoms. Progressive worsening, pain, unexplained bleeding, lump, numbness, difficulty chewing, swallowing, speaking, or moving the tongue and jaw require professional evaluation. Instead of using your mouth to try to guess illnesses, use it as an early warning system to help you decide when to seek help. It's amazing to think that such a small region is involved in eating, speaking, protecting teeth, and perceiving changes that deserve attention. The most important message is not to live constantly examining your mouth in fear. It's about knowing your normal pattern and respecting what persists. Brush your teeth twice a day with fluoride toothpaste. Regularly clean the spaces between your teeth. Avoid tobacco. Maintain regular dental checkups. And inform your dentist about all medications you use and any health conditions you have. And remember, this video offers health education, not diagnosis. No tongue color, breath type, or occurrence of gum bleeding alone confirms a disease, but persistent signs deserve to be seen by someone who can truly examine them. If this video changed the way you view oral health, like it, subscribe to the channel, and write in the comments which of these signs surprised you the most. Share this content with someone who still thinks that the mouth only reveals problems with the teeth. Taking care early doesn't mean panicking. It's about paying attention at the right time. Big hug and goodbye.